And I think you know the list goes on and on. Increasingly in this world where constrained resources, disrupted supply chain, growing demand, the challenges is just building up. Next slide, please. Many of you are familiar with the AT scale, the Global Partnership for Assisted Technology, which we operate across three strategic pillars: supporting countries, strengthening global enablers, and advocating for change. And by saying supporting country plans with the establishment or strengthening of national coordination platform and technical working groups, that these support the planning and implementation of assisted technology agenda in alignment with existing government structures. A focal ministry convenes implementing partners and key stakeholders, including relevant ministries. Again, moving from the ecosystem, from Minister of Health, OPD, civil society, development partners, private sector, a multi-stakeholder and multi-sectoral approach that supports extensive stakeholder consultation to develop and support and address fragmented efforts that exist in many of the countries. Support the development of national priority assisted product lists. And this list of programs implementation, again, comes in supporting government budget allocation, full procurement, local production, and the reduction of tariff and taxes. Next slide, please. In this slide, I think this is a core principle that underpins AT scale investment strategy and how we really work at country level. And the majority of the AT scale catalytic investment are country focused, but most importantly, government led, deliberately moving away from just isolated interventions and instead supporting countries to build the foundations of a functioning assisted technology ecosystem. In the first layer, it focused on strengthening enabling ecosystems. This includes policy and governance, sustainable financing mechanisms, workforce development, service provision system, supply chain strengthening, and data and information systems. These are building blocks that determine whether access to assisted technology can be sustained beyond a life of any project. The second layer, and the bottom, focuses on building and shaping markets. Globally, we know assisted technology markets remain fragmented, underdeveloped, and highly dependent on imports. And in many of the countries where we work, in low and middle income countries, products are unavailable, unaffordable, or inaccessible. From AT scale, the investment in market shaping interventions such as scaling up innovation, public-private partnership, demand generation, local production, and local assembly, it's key element. The objective is not simply to increase the numbers of products available today, but the objective in reality is to create healthier markets that can sustainably deliver quality assured assisted products at scale. What is important in these two layers is that it's not one or the other. They are mutually reinforcing. Market development without strong service system can increase product availability, but it won't increase any outcomes. Equally, strong policies and trained personnel cannot deliver results if products are not available and affordable and with quality. The sustainable access requires both, having strong systems and functioning markets. Working in a multi-sectorial, multi-stakeholder coordinated approach. Next slide, please. And the evidence from multiple countries and implementation context is remarkably consistent. And I'm pretty sure I'm talking here over the converted and over those who have seen it the first hand in practice. Single dimension investment rarely produce sustainable outcomes. Yet, much of our field in investment had historically focused on individual components of the system rather than thinking as a whole. We need to name some failures because, again, I know you have experienced all of them in your work. Products without services, such as wheelchair distributed without assessment, fitting, financing, training, follow-up, we know the consequences. It's documented. We know it could cause consequences at pressure sore, complications, reduced mobility, and the abandonment of the product. And services without workforce, we also seen it. Clinics, provision centers that are established without an adequate trained professional. It's like saying infrastructure without competency does not really translate to access. And workforce without policies, capacity developed without governance structure, professional recognition, financing mechanism, or workforce planning. And policies without financing, having national assistive technology strategies and commitment that remain underfunded. And that include also leaving them out of the universal health coverage or unsupported by sustainable domestic allocation of funds. We've seen that the P5 framework from policies, people, product, provision, and personnel to provide a useful lens for understanding the components of assistive technology system. However, it needs to be complementary with an actionable insight lie in the building block of the health system strengthening. We will determine sustainability at scale. These building blocks, including governance and coordination mechanism, financing system, workforce capacity, service delivery, supply chain, market development. We cannot choose one or the other. They create an enabling environment through which appropriate wheelchair provision can move from isolated projects to sustainable national system. Strengthening only one component, yes, it can improve outputs. Strengthening the ecosystem, improve outcomes. And in strengthening the ecosystem, it was ultimately deliver sustainability. Next slide, please. Kenya is a country I will use as a case study because it really illustrates what coordinated, government-led, multi-domain investment actually look like in practice. AT-Scale committed 5.5 million over 3 years through CHAI as an in-country coordinator. The program works across different domains, mobility, hearing aids, vision. On mobility alone, rehabilitation infrastructure has been upgraded across 5 regional facilities. Community-based rehabilitation expanded nationwide. Over 30,000 additional users reached with wheelchair prosthetics. Wheelchair distribution has been expanded to all 47 counties. But it's critically to point, and I will come back to this because the mobility work is underpinned by the workforce development, data system, policy recurrence, and supply chain strengthening. It is not wheelchair provision alone. It has to be a system investment for it to be sustainable. Let me go deeper a little bit on 2 of these dimensions in Kenya because it's the specific, I think it matters, on service delivery sustainability through the workforce. In Kenya, has been trained over 2,000 personnel, trying to be equal in gender, 38% are female. But this goes across the different domains, including wheelchair service provision. And part of the system, yes, for the trained personnel, for basic and intermediate wheelchair package, still a small amount for the 47 million population that Kenya has. But this number is integrated into scholarship pipeline, and students are currently enrolled, and the first generation are already deployed at a country level, and they have a mandatory public service commitment built in. This trajectory from education into system, it's also one part of a sustainability for the country. Institutional sustainability through data system as well. Kenya has integrated rehabilitation and assisted technology indicators into their national health information system, which this really enable real-time monitoring of service provision, resources allocation across the 47 counties. There's a national assisted technology dashboard that was launched last year that integrates partners mapping, facility label data, real-time Kenya Health Information System data, and assisted product has been added to the government management logistic, creating a reliable pipeline for procurement, distribution, and last mile delivery. And again, these are not just for project monitoring. These are integrated into the National Health Information Infrastructure Investment. Next slide, please. AT-Scale view market shaping as one, yes, under appropriate component of ecosystem development. It's underdeveloped. When markets fail, user experience stockout, providers face limited product choice, government overpay, manufacturer cannot predict demand, and innovation struggle to scale. And I think, again, these are things that all of you here in this meeting are very well informed. And in many low and middle income countries, assisted technology markets remain characterized by fragmented procurement, low purchasing of volume, limited market transparency, and insufficient incentives for suppliers. These are not service delivery failures. These are market failures. And market failures require market shaping intervention. The objective is not just to lower their prices. The objective is to create healthier markets that consistently deliver quality products and affordable prices. Made AT Kenya was designed as a market shaping investment, as an opportunity to test whether high quality wheelchairs could be manufactured locally in Kenya at scale at a price that could be competitive. Kenya presented particularities, compelling environment for this investment. There's a significant unmet need, estimated over 100,000 people requiring appropriate wheelchairs. There is a strong government commitment through national rehabilitation and assisted technology strategies in place. There is established service delivery ecosystem. And importantly, the demand goes beyond Kenya. What was missing was not demand. What was missing was sufficient product available, predictable supply, and local manufacturing capacity, capable to producing quality wheelchair at scale. AT scales an opportunity, playing a catalytic role, an investor and a strategic investor leveraging additional investment, alignment of partners, and approach this adventure. But again, the question was not to say if Kenya could produce local wheelchairs. The real question for this investment is whether local manufacture could become part of the sustainable solution to one of the most persistent barriers in assistive technology access: the lack of reliable, quality, affordable, and locally available products for the people who need them. The achievements have been real and technically significant with IMARA, which represents an excitement development. The prospect of locally produced appropriate wheelchair manufactured with ISO standards in the East Africa and for East African. But again, this intervention that it's in the final stages towards full ISO certification and market entry. It's only one intervention. Manufacturing capacity does not constitute a sustainable wheelchair ecosystem if it's alone. Sustainability must be integrated with national procurement, demand aggregation, quality assurance, post-market surveillance, and integration into national service delivery systems. Next slide, please. And this is Imara, which the name is in Swahili, meaning strong. It's been tested, and it's been using the design of the Rough Rider, but tested with local for terrain and with local AT users. They have different and updated quality in the design of the wheelchair. One more slide, please. And just a few days after World Day for Assistive Technology, and before I close my words, I wanted to actually acknowledge the World Day for Assistive Technology last week on June 4, and thanks to all of you here present who observed the day, who made noise about World Day for Assistive Technology, with the team of Unlock the Everyday and using and personalize it, me and my AT, because it really unlocks the everyday. Just think the power of this day. Only 2 years ago, 4 June 2024, World Day for Assistive Technology was launched. And it was launched it started conversation under that simple but powerful call to action and reminder that an assistive product, my wheelchair, really unlocks the everyday. And in just 3 years, it has grown global movement that has engaged millions of people around the world to help shape assistive technology into mainstreaming, adding this into conversations, and not only about one sector, on health, education, employment, development, gender parity. And we know the truth on this. It's assistive technology to unlock the everyday. Is access to assistive technology? It is a key enabler for human rights. And with that, I conclude my presentation, and I wish you a very successful and engaging annual general meeting. Thank you, and back to you, Alex.
Thank you very much, Karen, for that insightful presentation. It's quite remarkable to hear all the achievements and advancements that's made. I should have said at the beginning, I'm actually in Kenya at the moment, and I've seen firsthand some of the interventions and the investment that ATScale has done and things moving into action right now. We have a question from David Constantine in the chat. He says, Kenya is a great example of how many other countries are or could be like Kenya, and what are the reactions of various countries to the market shaping interventions? That's from David Constantine.
I don't see David. Hi, David. How are you?
Hi.
I would like to say nice to see you, but actually I don't know where you are in the screen.
I'm down the bottom of the cave, I think, with everybody else. My camera's on then. It was actually not quite. Kenya is a great example. Not of Alex, it was how many other countries are currently or could be in ATScale's experience, like Kenya, and have been receptive to it. And what are other countries that may or may not? What are the reactions to the market shaping intervention you've been doing as an organization globally?
There is indeed interest, and the reaction has been very positive. From the exercise that there's a report, and I can share here the market entry analysis for different countries in the region that has been, they are at different levels. And I'm pretty sure you know more than me in this respect, but countries are at different level and there's different interests. Some countries provide and have incentive from government to have that market entry for wheelchair provision and wheelchair production at local level, but they're really looking for that investment that has been doing right now with Made at Kenya. So it is compelling to see. And last week that we had the AT Scale board, we spoke from the ministry that engagement and how they're looking forward to really leverage this opportunity of having local production with IMATA.
Just as a follow-on from that, I'm actually at an event where the WHO and UNICEF are hosting 14 African countries here in Kenya. And it's all about sharing the learning and the experience amongst East, West, and North Africa, and some countries from Southern Africa as well. So I think now that there's this energy, it's quite encouraging to see how between the countries, there is this shared learning and opportunities for sharing. We have another question from Mina Maha, but I'm going to ask him to unmute because I'm not sure I think there might be an error in the question. So Mina, if you can unmute yourself and just ask the question, please.
Hello, everyone.
Hello.
Nice and happy to be with you today. My quick question is how practically we as individuals and NGOs can advocate for wheelchair accessibility and just an impact, as Ryan said, an 80 scale, despite we haven't that empowerment and that tools in real life situation.
I really like your question, Amina. Thank you, because it is a part of when we talk about how AT scale work at country level. It's creating also the National AT Committee or working groups. And as part of that, its mandate is to include organizations of persons with disabilities, NGO, to try to build up that ecosystem. So getting engaged through those national AT committees is the best way to enter and advocate strongly or have a meaningful participation as an NGO, as an OPD, through these national committees, to have a seat at the table at that moment.
Thank you, Karen and Mina. We have a comment from Laman Mansare from Sierra Leone, which reads, "Thank you, Karen, as we are also wheelchair technologists, and we have CHAI in Sierra Leone for the past 5 years now, but just developed 80 products priorities list. But the government of Sierra Leone has no scene of services for 80 professionals. We came back since 2006 from TATCOT as trained and qualified wheelchair providers. We were producing, before the TATCOT, 3 rigid wheelchairs shown on Karen's presentation. We need ISWP to visit Sierra Leone and engage the government." Yeah, thank you. It is quite challenging, and particularly what is happening in the region these days. It's quite difficult for governments as well. They are trying, but I have met some colleagues here from Sierra Leone, and I can also just pick up with them. I know that there is an issue around training and certification. We cannot necessarily commit to visit all the countries, but we can certainly, commit to come back to you. So, Laman, if you can drop your email in the chat box, one of my colleagues will take that down, and we can take this discussion further. And Vladimir, thank you very much for your comment. Sorry, just a reminder to mute yourselves. Just joined. Or Claire, if you can please mute. Thank you. Vladimir, thank you for that comment that the Ukraine will shortly publish results on prosthetic market shaping analysis as well as a paper in Frontiers. So thank you very much for that. There's a question from Deb Wilson, and this will be the last question we'll take in the interest of time. So it says, "Hi Karen, are the products for locally manufactured shared designs from existing products for less resource settings?" Or I think it reads, "Are the products for local manufacture shared, are the designs shared with less resource settings as well? Are they open source?" I think. Deb, is that correct?
If I understood correctly, is
yes, I was
if the
meaning
designs are open, shared.
Yeah, so the Kenya design, they adapted from an existing design to be more suited to the local context. I just wondered if other countries, are there a lot of existing producers, for example, the chairs that are on the CLASP list, are those designs available as open source for countries to produce locally?
I don't think they are open yet, but there's always opportunities and lessons learned that we have. For example, the implementing partner Motivation in Kenya, they own the design, and it's been an updated version of one of their design. So, but I think in this world and in where we are, there's always room for anything, right? And they're not open yet, but we never say that can be a negotiation and a door to open.
Wonderful. Okay, so Karen, thank you so much for your presentation and your insights, and thank you to the community as well for those reflections and for the questions. We will share the recording for those that have attended. And obviously, Karen, I'm sure you wouldn't mind if your details are shared with colleagues if anybody wants to find out a bit more. So thank you very much, Karen. And if you could just do a virtual clap to thank Karen for her time, and we'll now move on to our chairperson's report. Thank you, everyone. I would like to welcome Silvana Contepomi, the chair of the ISWP board. Silvana is well known to our sector. She's a highly respected clinician, educator, and a strong advocate with several years' experience in neuro rehab and wheelchair provision. With that, over to you, Silvana.
Thank you, Alex, and thank you especially to Karen for her message, very inspirational, and for bringing us this example, this Kenya example, where for sure for the successes to show the strengthening of the whole ecosystem. It was very interesting to see the results. And as David said, hopefully many countries can take the model to also scale their AT services and systems. So good morning or good night or good evening to everybody. Now I want to share with you our key achievements. And as you know, we maybe you know, but we have a strategic plan where we did it in 2024, and this is a 3-year strategic plan. You also know that it's only 1 year ago where all this plan that we had in 2024, we had to adapt it. The plan is based in 5 objectives related to the 5 Ps that Karen explained just now, because we also think that to strengthen the wheelchair provision needs to be done with eco plan to change the ecosystem. And you know that in 2025 some of our or one aspect of our plan change, that was the financial support we had. It was 1 year ago, where I really want to thank a lot the ISWP core team, also the ISWP board, and I would say all the ISWP community, which I feel that we stand still because we could feel the need that the world has to improve the standards and practice of wheelchair service provision, and to strengthen the systems. And we had to change plans, but we do have the same objectives and strategic plan there, which we are going to share today with you. Some of the results and how we are moving forward. Last year also, we had our milestone of 10 years. We had some events around the world, especially in the sitting symposiums, but in the Oceania and in the international sitting symposiums, but also in small events where we could really celebrate the history of being as an organization, and all the work we have to do forward, but also relying on our history and how are we going to grow. So it was very good. There were very good opportunities to also get together and build up the community in those events. We also had the second, this year was second, but last year we initiated the International Wheelchair Day, where we want to celebrate the user's impact in using an appropriate wheelchair and moving around with an appropriate wheelchair and having a good life, but also the workers, all the people that work around producing products, clinicians, etc. All of them, we want to celebrate on that day. And we have, I think, something we're going to see afterwards, but it was a very good opportunity, and it's growing each year. It's growing how the community wants to come out with these stories and this kind of celebration. We also have launched a mentorship program, which it's moving around, and we have to, of course, improve always, but it was very well received, and it was successfully launched. On the other hand, I'm sorry, today Karen talked a lot of local people doing joining the mission and vision. In this case, I'm going to talk of ISWP, but of all AT services and systems. But we believe that we need to build up chapters in the world where the local people can share the vision of our global vision and mission of ISWP, and also make the changes and take the challenges of each of the different regions. And we are happy to tell you that this year we are launching the first chapter, but many more are coming afterwards. But we are doing a model. As you mentioned today, Kenya is a good model for one thing, and we are trying to build a model of a chapter to really work together this global and local activity to be done, that it's very important. And also there's we built up an annual report of everything that happened in 2025, that it's circulated if you want to also see more details of it. But I just only want, for finishing, to thank the community, the community of users of personnel, of manufacturers, all of directors or people who make policies at not only at national levels but also at institutional levels, where they are joining and trying to build up the standards of practice to achieve what we want, all of us want to achieve, is that every user in the world can access to the appropriate wheelchair in any part of the world and have a happy life. So this is my message, and we're going to see some of these details in the rest of the presentation with the AT team.
Thank you very much, Silvana, and thank you also for your leadership and your courage to stand up for the things that we need to see driven in the sector. And again, also thank you to our board who volunteer their time and services to ISWP. You know, it's quite a challenge, you know, doing what we do, but because of the commitment and the dedication of each and every one of you, we're able to push forward in spite of some of the challenges. Okay, so we're going to move to the next slide, and I'm going to hand over to Eric Wunderlich, who's our treasurer. Eric is the Healthcare and Disability Manager for the Church of Jesus Christ of Latter-day Saints, who's going to provide us with an overview of the finances. Over to you, Eric.
Thank you, Alex. So this slide shows kind of the last 3 full years of ISWP's revenue and expenditures. I think many will be aware that of the changes in the funding landscape early last year. And you can see that in the top revenue line, where a lot of ISWP's revenue in 2023 and 2024 was from a grant from UN Ops funded by USAID, which was terminated in early 2025. But I think thanks to Alex and everybody's efforts, we're able to kind of generate income from some other sources and keep continuing with ISWP's mission. You can kind of see on the expenditure side kind of keeping those expenditures at a steady or slightly reduced level to align with the revenue. And while there's always opportunity, I think, to improve a nonprofit's financial situation, I think we're in decent shape at the end of 2025. So.
Thank you, Eric, for that overview, but also thank you for your stewardship and oversight over the financials together with the Finance Committee. It is quite a tightrope, and it's not just us, it's many organizations across the sector and across the world that are also experiencing difficulties. And we've been grateful for the support from our partners. We will have time at the end for any questions. We do have a lot to cover, so I'm going to move us to the next section. And I'm now just going to briefly walk us through some of our accomplishments. And again, I just want to start off by saying thank you so much to our team. We're a very small team, but we are quite effective, I think, in what we've been able to achieve. So Beth, Sarah, Claire, and the others that have come before, and again with our board and all the many volunteers in our committees and working groups, none of this would be achievable. So next slide, please. We've heard a lot about the challenges. It's a very tricky environment that we are facing over the years. But at ISWP, we've had some issues around our IT systems that members told us about. We obviously lost quite a large chunk of our funding from USAID. We had some staff changes, the legacy staff members that have been with us for a long time. But equally, there have been a lot of opportunities for ISWP. We're going to talk a little bit about the certifications. We're starting to see that there's a real recognition and a dire need for certification across the many countries and across the world. And in response to feedback from members, we are now prioritizing and optimizing our online training as well as the in-person training. And Beth will touch on that a little bit. We've also got a very clear strategic direction that has been developed in conjunction with our board of directors. So it's really set the scene for where we are going. And our message and our mission is very clear, that everybody who requires access to an appropriate wheelchair does so with the dignity and respect that they require. There's much more increased visibility for ISWP, and a lot of that has to do with the brand work that we've done. And we're very grateful to our social media person, Meg Bossman from Honeycomb, who's with us today, I believe. And she's really helped us to campaign and flip things around in terms of showcasing the work that we're doing. Next slide, please. I really want to touch on International Wheelchair Day. As we've heard before, this is a day to celebrate the impact of having an appropriate wheelchair in people's lives, and to really show what it means to have in terms of the right wheelchair at the right time. It really showcases independence, access to opportunities like work, leisure. And this is the second year we've been running it with the same theme of unstoppable. Next slide, please. So we had a lot of engagement this year. We had 159 new followers, both on Instagram and LinkedIn. We had 11,605 unique visitors reached through our communications. We had 27,724 impressions and 1,656 engagements across social media. I'm not an expert on the terminology in terms of impressions and unique users, but we've managed to really improve our reach. And moving forward, we really are looking forward to more engagements and working with many partners across the globe to showcase what can happen when everybody comes together. So if we go to the next slide. These are again some statistics. So we were tagged in 113 or more International Wheelchair Day posts across Instagram and LinkedIn. We received 35 or more wheelchair impact stories from social media tags and emails. And we had events across the globe, including countries like Kenya, Lebanon, Spain, Argentina, the UK, South Africa, and many, many more. And activities ranged from, for example, in Lebanon, they had the the national football team come and launch a new the equipment and sport for wheelchair football in their country. In South Africa, we partnered with Sean Equip Social Enterprise and a local adaptive surfing company where we did a day of adaptive surf for many individuals who have disabilities and got them to experience that activity. And activities ranged across the globe from wheelchair basketball to just awareness raising campaigns. So we're very grateful to the partners. And if you go to the next slide, we'll see some of those activities in a collated montage. And here you can see some of that. And again, Meg was very instrumental in designing the campaign. And my thanks to Beth and Christopher Stanfield, who led the advocacy committee and made sure the social media kits and activities were showcased in the amazing way that they have. So again, the day was not to really show what we can do, but it is to show the power of coming together and also to showcase what can be done with the right investment and to raise awareness globally about the power of having the right wheelchair at the right time. So we're really looking forward to International Wheelchair Day 2027, and we're looking forward to working with many of you on some of those activities as we plan for the future. I'm going to go to the next slide. So again, just some statistics in terms of our social media impact. As you can see, we've had a 48% growth over the last year in our LinkedIn communications or following, and also on our Instagram as well, 54%. Now I'm told that the industry standard is about a 20%. So we far superseded that. And I think this is all thanks to the great work from our community, but also just having the right people to help and support us in terms of building that. And as I mentioned, you will notice that, we're doing a lot of activity on social media. And this is not just to pat ourselves on the back, but we need to keep the conversation going. We need to make sure that the right people hear the messages across policymakers, industry, people who set the standards, and also to amplify the voices of wheelchair users themselves. This is something that has been missing in the past, but we're really using this to grow the momentum. So we'll go to the next slide. I just want to briefly touch about our partnerships. I'm here in Kenya, and I've just met with Peter Mbungwa from Motivation Africa. We recently signed an MOU with their organization. We're very delighted to plan and design training across the health system here in Kenya. I've met with many partners, including colleagues like Joseph Compe, who's joined today from Bethany Kids, and other people across the sector. There's a real dire need in Kenya and across the region here in East Africa to build capacity. So we're very excited to work with them and colleagues in Sesabel as well, equally to look at how we can upskill the current and future workforce as well. We also signed an MOU with the Wheelchair Alliance in the UK, which is a powerful movement that is looking at how to amplify the voices of wheelchair users and lobbying all across the health system for improved wheelchair provision through the service in the United Kingdom. So these are just 3 partnerships that we wanted to showcase, but the team are working, with many others. So Deb is here from who previously was part of the organization that ran the training, Seating to Go. I lost it for a minute, but Seating to Go. But we're working with colleagues in New Zealand around how we might build capacity in New Zealand and across the Pacific countries as well. And there are many of you here on this call as well, but far too many to mention. But these are the 3 we wanted to spotlight today. Next slide, please. I'm going to hand over to my colleague Beth Sheehan, who's our program manager, and she's going to walk us through the next section.
Thanks, Alex. And nice to see so many people online today. I know that I've spoken to many of you over the last few months around training and certification, but nice to see you all here. So the first slide here is around our membership growth for 2026. So we have now passed our 12-month mark for paid memberships. So as of the end of May, we had 434 individual paid memberships and 14 organisational. You can see we still have a lot of interested individuals at the associate level, but the beauty about the individual and organisation is that where they get more access to our benefits, discounts for webinars, access to more of our resources and other relationships for conferences as well. Our goal is to, however, try and increase those individual and organisational memberships to try and keep the sustainability going for ISWP. One of the big roles, and next slide, is that I undertake is the training and certification programs for ISWP. And here I've highlighted 3 of our success stories over the last 12, 18 months. The first one being that Ukraine has trained now over 270 professionals at a basic level. And Vladimir, I'm sure you'll correct me if I'm wrong, but I think it's about 15 at the intermediate level, and we now have 9 national trainers across Ukraine. And as of February this year, we had the first trainers conduct their first training at the basic level. So it's a nice systematic and whole systems approach, and one of our sort of spotlight organisations and groups to work with to build that sustainability. We have just also completed, thanks to Silvana and Tamara Kittleson, a Peru-based training for 2 organisations that came together and collaborated to have 20 providers undertake their basic and intermediate training programs through a hybrid and face-to-face training process with Silvana. And those trainees are now completing their certification exams. But also we had 2 very experienced clinicians who have now also achieved their basic trainer. And so hopefully we will see some more training sessions come through from Peru to build that sustainability. And I know that there's some other Southern American countries looking at doing the same. And finally, one of our highlights here is Motivation India, who have conducted a hybrid training with a group in Nepal at the basic level. And I know that they're looking at continuing those training programs into the intermediate level as well. And I really enjoy working with these partnerships and groups across the spectrum, because it really does highlight the need that is still out there, but the ability to build these systematic and whole systems approach with qualified trainers to go through the process. So thank you to everyone involved. And I know that we've got a couple more big groups coming through. I know that we've got a few people from the Pacific online, and hopefully that same process will be undertaken later this year. Next slide, please. As you know, we have the certification process at a basic, intermediate, and trainer level. And last year was our biggest year by far. So you can see there in the first 4 or 5 years, we only had about 104 certifications completed, and slowly starting to rise with a large amount in 2025. And that really was thanks to the WHO Ukraine, but also LDS for the number of training programs that they conducted, particularly across Africa as well. So far, at the end of April, early May, we had 337 completed, and I know that we've had a few more come through as part of the Peru training. So hopefully we'll see that number grow throughout 2026. And currently we have 1,330 certified individuals that are current, and their certifications haven't expired. For those that haven't seen the communication, we now have the basic certification valid for 3 years to align with the intermediate certification as well. So hopefully that is a little bit of a draw card as well for the certification process. Next slide, please. So we have a few big projects happening in 2026. We managed to secure some funding. Thank you again to LDS for this upgrade of our online training at the moment, specifically for our basic training. We listen to the community and understand that there are a few glitches with the historic training program. And so we engaged a working group to work alongside Silvana and myself to go through the basic training that we currently have. And we're currently following these 7 training steps to optimize the basic online training in English and in Spanish initially. The feedback there from the working group was that we needed to improve our format and usability, the content quality to align with the new 2023 4 steps of the WHO ISWP guidelines, and ensure that it's adaptable as well to the different contexts that we work across. So as part of that, we have gone through that review process from that working group. And we are now working on the framework for that content, which is on the next slide, working alongside the IT team to update the software and improve the usability of that. So over the next few months, Silvana and the team will be working on these 2 core or 2 significant modules that will start to outline the history and the context of the systems level approach, aligning with the WHO guidelines. And then we'll get into the 4 stages under the service provision. So watch this space, and hopefully by the end of this year, early 2027, we'll be able to launch that new online version for the basic level. So I'd now like to hand over to Sarah, who has been working on the mentorship program and also the chapter development. Over to you, Sarah.
Thank you, Beth. So yeah, Silvana already mentioned one of our most exciting developments this year is the ISWP mentorship program. We know firsthand wheelchair service provision can be incredibly isolating, especially for people working in less resource areas and people without a local peer network. So to bridge this gap, we're pairing experienced professionals with people starting out in wheelchair service provision. Each pair meets online over several months and mentors support with reflection, encouragement, and sharing their experience. So this year we're making partnerships with the world. We've got partnerships between Australia, Pakistan, India, Uganda, New Zealand, and Haiti. And I can see some of our mentors here. So thank you so much for your participation and your support. I see some mentees as well. So I think really what makes this program so special, it's going beyond standard training, and it's really about building relationships. It's about building our community, and it's about solidarity across our sector. Looking ahead, we're basically aiming to develop a really strong global network of support, and we're aiming to help strengthen local leadership. And ultimately, it's about improving wheelchair services for the people that need them. Next slide. So,
Sarah, I think you've just placed yourself on mute. We've just lost you.
Am I back?
Yeah.
Okay, thanks. Silvana also mentioned about our first ever chapter model for ISWP, which we're now developing with the first pilot chapter launching in Argentina. So we're working on developing chapters because we've recognized strong, sustainable wheelchair services basically need local leadership and local networks. The chapters allow for professionals to collaborate in their own language and also their own context, but still connected to the wider global community. So Argentina is our first pilot chapter, and over the last few months, we've been working through the legal and administrative steps that are needed to set this up properly. That's included registering the organization, defining the relationship between the chapter and the global organization, and working through practical details. Because this is our first chapter, we've also been making sure we document the process really carefully so we can learn from it, we can develop a template for future chapters in other countries. And we are right on the edge of launching the Argentina chapter, and we look forward to formally introducing it in the next few weeks. It's going to be, we hope, a powerful new model for local ownership. And that's it. Next slide.
Thank you, Sarah, and thank you, Beth. I don't know, Silvana, is there anything you wish to add around the chapter or the online training?
I think Sarah explained it very well, but just to tell you that we are hopefully by this, at the end of June, we'll launch it. We are just waiting. We had a conversation between both IT teams, because it's very important to have a web page so that anybody can know what is the proposal of ISWP Argentina. So we're working on the content and with all the directions we received from ISWP Global. And when that is finished, we have just signed the agreement. So I think hopefully before July we'll have a launch of this chapter, and we'll come with the news of what, and we hope to see quickly everything that is planned, because we have a lot of expectation, and many people here in Argentina are willing to get into it and to start working on also we will have objectives for the 5 Ps to really make changes in what is happening today in our wheelchair service provision in Argentina, and especially at public level. No, so we'll come with the news when we have them. Thank you.
Wonderful. Silvana and I have spoken for many years about, and together with the board, about this vision of setting up the chapter. So we're really glad to see it come to life, and yeah, looking at scaling it up as well, because the need and the demand across countries is huge, and the only way to build sustainable, resilient systems is to work through local. HSBC Bank in the UK has this slogan, think global, act local. And that's kind of what we want to do, is to use the global initiative, but using the cultural and context to build that. So finally, we're coming to the end of the AGM, so there'll be some time for action for discussion. But we wanted to just have a call to action. We have, often we seem like we're in an echo chamber because the people who come to the AGMs and who come to our meetings and who work with us are the ones who are really committed. And we really value you and appreciate you, but we need to do more. We need to continue to advocate for improved access to wheelchairs and services, and to continue to drive the agenda. We really need your help as members to promote ISWP certification and membership. Obviously, finances are important to us, as we've mentioned before. We continue to try and diversify all our revenue streams, and so we are dependent on the memberships and certifications. So, but other than that, this is a great way to build and upskill people. And we just want you to continue to support our missions through any of the activities that we have designed specifically around that. And we are working with a colleague by the name of Marina Lokacheva. We had a really nice workshop with the team, and she's been helping us to think through how we can try and design, the benefits for members, particularly associate members, to try and convert them into individual and organizational members, because we need to hear from you and we need to respond. We are here to serve, and our goal at ISWP is to make sure that we can, respond to the needs of our members. So, and the only way for us to respond to that is for you to tell us, and the only way to do that is to become members and to spread the word, and for us to build this collective movement as we see it. And the things that we are doing, we are moving in the right direction. There are challenges, but we need to keep going strong and have the courage to stand up for what we've started up to do with ISWP. So with that, I'm going to move to the next slide, or we can stop sharing, because this is the time for us to open for any comments or questions from all the participants. So if you can raise your hand, if you have any comments or queries, we can open the floor. We've got about 10 minutes or 15 minutes for this.
Yeah.
Laman Mansari, do you have a question or a comment?
Yeah, thank you very much, Alex, and all the team members for the wonderful presentation, Savannah and Karim. We really appreciate it. And we've been wheelchair professionals for several years now, but we are not recognized by the government of Sierra Leone. As I said, they don't have a wheelchair service scheme in the Ministry of Health. So Child has been partnering with us. We are part of the development of policies and artistic product lists. But we most time contact organizations like Motivation. Also, they were working with us before, but later they said they are working in East Africa. So my concern is all the organizations that support wheelchair service provision are focused in East Africa mostly, and maybe Southern Africa and not West Africa. And we have a lot of, every day we are getting cases of people that need wheelchairs and other assistive devices, but we don't have enough professionals. I think Eric is aware we have been working with LDS for some years. Then later they said they will work with the government, and the ministry does not, their focus is not to support wheelchair service provision. So this is a challenge we are facing in Sierra Leone. Thank you very much.
Thank you, Laman, and that's really unfortunate to hear the situation in your country. I think that's quite an accurate reflection that a lot of investment is in East Africa and some in Southern Africa as well. And hopefully, from this meeting today, there are colleagues from Sierra Leone here with the WHO and UNICEF, And part of what they are doing now is about how to accelerate assistive technology in our countries. And there's a lot of shared learning, particularly there are government officials here about how to design policies and how to change the financial budgets to ensure that we can include that. But I recognize what you're saying. It is a reflection. Perhaps we can have a conversation with Eric and any other donors who are interested in supporting West Africa. There are colleagues in Ghana who are very keen to support that, and Nigeria as well. I think one of the challenges from an ISWP perspective is around the language. So some of the countries in West Africa are Francophone, and but that doesn't mean we cannot provide training and support. So perhaps if you can drop your email in the chat or reach out to one of us if you've got our email addresses, and we can take that conversation forward. But thank you for sharing the reflection about the situation in Sierra Leone.
Thank you so much.
Thank you, Lam. I see a comment from Convenience. I appreciate ISWP work in wheelchair service provision. I'm certified basic and intermediate wheelchair and seating professional from Kenya and support and ready support. Currently carrying out impact evaluation on effects of appropriate wheelchair fitting amongst youths aged 18 to 13 with mobility impairments in Kenya. Convenience, if you are able to, perhaps you could unmute yourself and maybe just give us some insights about this evaluation. Convenience, if you're able to unmute yourself. Okay, I think there might be a technical issue, but I think this would be really fantastic to see the outcomes from this evaluation, and we can then we can share it with the community. Vladimir, I'm going to put you on the spot. You know, I always like to put and you've put up your hand at the same time. So great minds. Over to you.
Okay, thank you very much, dear colleagues. Greetings from Ukraine. So thanks to ISWP and the MIRA, Tavashe recently conducted the assessment for complex wheelchair provision. So we're in the process of drafting the report and thinking forward about the piloting of some kind of seating clinic project, so which is totally new for Ukraine. A lot of colleagues proposed it to be implemented a couple of years before, but currently we try to do it. Hope the time is at place. So over.
Thank you very much, Vladimir. And again, thank you for the support that you provide us and the whole health system. We look forward to seeing how that progresses. Thank you.
Oh, could I have a word? I don't know how to put my hand up.
Go ahead, Ruth.
Thank you all so much for this fabulous meeting, and also for making it possible to have it in Spanish too. That's wonderful. I just had a quick question. Is it possible for more people to participate in the discussion group through the Wheelchair Academy? Mentors, members, board members, that we can have a more vibrant discussion there? Because I know in Ecuador we have lots of questions and we would love to use all this amazing knowledge base that we have here. Thank you.
Thank you, Ruth. That's actually a really good question and reflection. It is very early days that we've launched the discussion board, and our vision was that it would organically, grow, and members would start to discuss amongst themselves. But internally, we are thinking that we need to probably do a little bit more prompting and trying to get the conversations going a little bit more. Perhaps we can have a discussion with you as well around some of those, where we can actually post questions for discussions, maybe do little surveys or something that we can get a little bit more engagement, because the discussion board is open to members, and we haven't had as much engagement as we thought we would, but this is something that we can talk with you and others to get some ideas how to get a little bit more engagement.
Thank
Joab,
you.
thank you. Okay, Joab, over to you. If you can, yeah, there we go.
Thank you, Alex. Thank you, team. I think for me, my name is Job from Bethany Kids in Kenya. I truly want to thank ISWP for what you're doing. The team is doing amazing. Us here in Kenya, and the need is so huge, and we need to meet the need through trainings, because this is how we can also always provide the appropriate devices that is needed across here. And I'm happy that the government of Kenya is playing a key role in supporting and having the goodwill from the current presentation. So that's one of the highlights that I want to highlight. Thank you so much, Alex.
Asante sana, Joab. And I had the privilege of meeting Joab and the team at Bethany Kids on Friday. Traveled to Kijabi, about an hour and a half out of Nairobi, and the situation that they find themselves working at a very rural hospital with challenging roads. And we talk about, improving access to wheelchair provision. But, when you look at the first and last mile of even just getting to the hospital, the situation that Joab and the team are working with is very challenging, I have to say. So thank you for the work that you are doing also in the Kijabi region, and looking forward to working with you. Sophia, I see your hand up as well. So over to you.
I only want to say thank you for all the work that you are doing, and looking forward to launch Argentina chapter. And we are really excited to work and have all the expectations to help to this part of Argentina and all this that you are doing there, and working with Silvana so that we can launch it here and we can have all the expectations, and yeah, looking forward for that. So thank you very much.
Thank you for the support, and we expect that Specs will be one of the first sponsors for the chapter. So we'll be coming to you and looking forward to seeing how that develops. But we also appreciate the work that you are doing in the region. Rosie.
Yeah, I just want to reiterate what Sophia is saying, just in relation to the fantastic work that's been achieved, given all the challenges. And we can see that the trajectory is going up, and that we are reaching more people, on a daily basis. So it's fantastic. And I just want to, I suppose, congratulate the team, the small but very impactful team of ISWP. And I look forward to working with you over the next year, and hopefully that Ireland can have a significant collaboration, hopefully with ISWP in the coming year. So because we have just completed our WHO ATAC evaluation assessment, and there's a real commitment from Ireland in relation to the provision of assist technology services, and so I'm going to be working on that, and particularly in relation to wheelchair service provision and sustainability, which is one of my core focuses of my work. So I just want to say thank you, and I look forward to working with you in the next year.
Thank you very much, Rosie. And I think, I've mentioned this before, and the team has mentioned it. Rosie is one of our board members, like many of the others, have been so instrumental in making sure that this organization is sustained through bringing the partnerships, to bringing opportunities. And we were fortunate to be involved in one in Nepal with the Frontiers Rehab that Rosie was very instrumental in bringing to the table. So I'm very grateful for the support. Your ambassador of Ireland is supporting this event here in Kenya at the moment, and it's really good to see what Ireland is able to do to support not just the Irish health system, but also to show their support for the systems across the globe as well. Okay. I see Marco has just entered. I'm not sure. if there's any other questions. Ali, I see, given ISWP's strong relationship with WHO and UNICEF and humanity and inclusion, could ISWP advocate for greater global support and funding for wheelchair services by issuing a joint letter or a call to action? The need is enormous, and it is important that support follows the WHO four-step wheelchair service approach rather than focusing on distributing wheelchairs. I think that's a really good reflection, Ali. We are developing position papers around particular areas. One is around the donated or mass distributions that we see across the globe, or donated equipment that has been used. And this is an approach that we are taking to deliver that. And the WHO and UNICEF are also very much committed around promoting the service provision model. And we can see that as of the workshops that they're developing across the various regions as well. So yes, we will be working on certain position statements and making sure that we work with the right stakeholders to try and advocate for governments. But as we all know, the situation across the world is very dire in many countries where financially the systems are very stretched at the moment due to, crises, from humanitarian crises to other things going on in countries, but we will take that on board and work with the stakeholders. Marta, I see, following Spanish translations suggesting to explore Arabic, especially considering the experiences in training and provision in under-resourced areas. That's a really good reflection. I think we're also looking at French, and if you just give us a little bit of time, we're just working on mobilizing some funding to ensure that our resources can be accessible in other languages. So we take that on board. Marco, I know you've just joined. Marco Tufani has been working with ISWP on some of our research opportunities. So I know you've just joined, but I don't know if there's any feedback from your side around the work that you've been doing in the Ukraine together with one of our board members, Amira Tawashi. Sorry to put you on the spot there.
No, okay. So thank you. Now, I had some feedback from the work we have done with in Europe, in Ukraine. In the past, I think 2 years and a half, we trained more than 200 real professionals in the whole Ukraine. Now all the oblasts of Ukraine are covered. We create also the first national task force in Ukraine for wheelchair service providers, and we have the first workforce that can provide training in their own country by themselves. So they are now continuing their effort to implement service provision at Ukraine, and that's it, I think. Thank you.
Thank you, Marco. And we just recently today had some good news that the WHO is, we put in an application to showcase the case study in the Ukraine, and they've just accepted that to expand it into a full case study. So it really helps to showcase a whole systems approach. Okay, so I think we've taken enough of your time today, and it's probably way past many of your bedtimes. So if there are no other questions or comments, I'm going to call this AGM to a close, but I just want to say thank you so much for your commitment, your time, and your encouragement. We cannot do what we do without your support. So with that, I'm going to call this meeting to a close and wish you a good rest of your day. So thank you and goodbye.